In this video, I'm going to show you how to do a subcutaneous injection for semaglutide and tirzepatide. So for example purposes, I'm actually not going to inject myself with a needle, but I want to show you at least the technique. So what you'll want to do is, wash your hands, clean the surface area, clean the vial for a good 10 seconds, pull back the amount that you need in air that you plan on pulling from the syringe. Again, I cleaned all of this. I then am going to put it in here, push the plunger down with air, invert the vial, wiggle my fingers down to the plunger, and pull back the amount of medication that I need. I am now ready to flip the vial back over, take this out, keeping it sterile and untouched. I have my cap that again has not been touched, and I'm going to recap my needle. I'm then going to take the syringe that's ready to be injected and place it near me. Then you're going to want to clean the site of injection. So sites of injection for subcutaneous injections. Subcutaneous just means the fatty tissue. You can inject in the fatty tissue below your arm, in any of the 4 areas of your abdomen, and then in the thick fatty skin right above your thigh. So I'm going to go ahead and take my alcohol swab, and I'm going to clean the area for 10 seconds. And for example purposes, pretend I cleaned it for 10 seconds. I always recommend that my patients keep the alcohol swab there. If you can, kind of lay back and it will stay on there so that you know the site of where you cleaned. When it's wet, it's really easy to have it staying on the site where you plan on injecting. So then I'm ready to do my injection. So again, for example purposes, I am not going to inject myself, but I just want to show you what it would look like. So what you are going to do is pretend like I have uncapped the needle and that I'm ready to inject. So again, you will uncap the needle. You will lift, the garment on, or lift the garment up of the area where you're injecting. You will remove the alcohol swab. You will then pull the fatty tissue of skin, whether it's here or your thigh, and you have the needle off already. So then at this point, you are going to take the needle and inject it at a 90-degree angle, holding the fat, pinching the fat. So again, pretend the cap is off. You will be injecting it into your skin at a 90-degree angle as such. You also will then push the plunger down. Leave it in for 5 seconds, 1, 2, 3, 4, 5, and pull the needle out. You will then recap it and put it in a sharps container or an enclosed container. You will do the same thing for an intramuscular injection. However, you can do it in the deltoid muscle. You can do it in the gluteal muscle, which is the top part of your buttocks, or you can do it on the top part of your thigh, also known as your quadriceps. So again, I just want to show you for example purposes. We can pretend that I have done all of the proper techniques for cleaning, and I've cleaned the site, right, for 10 seconds. I left my alcohol swab there so that I know where I cleaned, so we can pretend that it's sticking and it's wet and it's sticking there. I then would uncap my needle. So I'm just going to pretend like the needle is uncapped here. And I'm going to, at a 90-degree angle, go ahead and just push the plunger down. Leave it in for 5 seconds, 1, 2, 3, 4, 5. And then gently pull the needle out and carefully recap the dirty needle and place it in a syringe. You have now successfully done your injection. 2 things I want to point out for storage. You will always want to keep tirzepatide semaglutide, also known as Wegovy or Ozempic, and tirzepatide is known as Mounjaro, or vitamin B12 in the refrigerator at all times. For any lipotropic vitamins, such as Lipo-B or Lipo-C, you can keep that in room temperature. For Lipo-B injections or vitamin B12 injections, you can inject these in the subcutaneous tissues, or you can also do this intramuscularly. I prefer intramuscularly for B12 injections as well as Lipo-B injections. But if it's easier for you to do both injections doing it the same way, then that is completely fine. So you would, for example, you would do your semaglutide injection here, and then you would also do the B12 or Lipo-B injection here. If you plan to use the Lipo-B medication and you plan to do it or inject it subcutaneously, you will want to use the same sized needle that you're using for semaglutide, which is a 30 gauge needle. If you are going to inject the vitamin B12 or Lipo-B injection and intramuscularly, you are going to want to use a larger needle. So this can range from anywhere from 25 gauge all the way up to a size 29. And that is because when you're looking at skin from the outer surface to in, the fatty layer is always on top, and then below that sits the muscle, which makes sense as to why when you're doing a sub-Q injection, you'll need a shorter needle because the fat is closest to the surface of the skin. And for an intramuscular injection, you will need to use a longer needle because it's farther away from the surface area of the skin.